Adam, thank you so much for sharing your time with us today. We continue to look at immunity with our next guest. Catherine Hankins is the co-chair of the COVID-19 Immunity Task Force, and she's here to talk about results of a recent Stats Canada survey. Catherine, some surprising information from this survey.
It was really interesting. I mean, first of all, it showed us how low antibodies were, how much immunity we had going into the third wave. No wonder that third wave hit us hard. But it showed us that people over 60 had the lowest rates of infection in acquired antibodies, which was surprising. But I guess we were not in long-term care facilities or retirement homes. So these were community living seniors, and they were obviously following the guidelines. The highest rates from infection were among 0 or age 1 to 19, basically. So in children and adolescents. And they had no vaccines. So it wasn't like we were picking up antibodies from vaccines. This was from infection itself.
Yet most of these children were not showing any of the symptoms of the infection.
No, and in fact, it's going to be interesting. You know, we found a number of people who had no symptoms and never had a test. So if we looked at everybody that had antibodies from infection, about a third of them had never had a test. And most of those didn't get a test because they had no symptoms, which meant they could have been transmitting to other people. They had no knowledge. So it kind of underscores why physical distancing and masks have been so important.
How do we use the results of this test, knowing that this was just before the third wave?
Well, one of the things that was striking, this is the first truly representative study of all of Canada, and it showed us that Canadians of visible minorities had double the infection rates and half the vaccine uptake. Now, that was just before the third wave. So I know there's been a lot of work going on now to reach out to them and find out, are there hesitancy issues that are totally related to logistics? They just can't get in to get a vaccine because of their jobs or whatever. Are there community leaders that need to speak out and answer questions and help people form their minds up about getting a vaccine? But with Delta on its way and now starting to settle into unvaccinated populations, we really need to get that first dose and then the second dose into everybody that's had the first.
This task force is truly national. You have representatives from all of the provinces and the territories sitting on it.
Absolutely. 10 provinces, 3 territories. And this survey was 10 provinces and 3 territories. So it was urban, semi-urban, remote, rural, whatever. It really captured Canadians across the country where we were at going into that third wave.
Catherine, with the results, do you feel that this points out that even as Ontario heads into stage 3 of the reopening plan, that we should still continue to wear masks and socially distance ourselves from others?
Yeah, I think everybody has to use their own judgment, risk assessment. And it's not a question of what's legal and what's not legal. Let's do what we think is safe. So if we go from 2 meters to 1 meter, you know, if we would go with no mask necessary, if everybody is vaccinated, I mean, let's have conversations with each other and let's do this safely for everybody.
Catherine, when we look at the term herd immunity, there's a lot of discussion right now whether or not we're actually going to reach that goal.
Yeah, I personally don't like the term herd immunity. It works well for a disease like smallpox, where every case is symptomatic and you see it. This is not something that we're ever going to get to herd immunity where there are no more people susceptible. It's really going to be one where we're aiming for vaccination levels that are keep our hospitalizations down, our deaths down. But this virus is going to be with us for years and years to come. So we've got to get our vaccination rates up as high as possible, probably around the 80–85% mark, and that we continue to show, you know, some judgment in our precautions and so on, but we're going to be living with it.
The COVID-19 Immunity Task Force has a town hall coming up July 15th. Can you tell me what we can expect that day?
For the town hall, it's an opportunity for people to see the results and to hear the perspective on the results and to pose questions. There'll be a moderator. You can put questions in the chat. So it's a chance for the public to understand this study better.
And people can pre-register for this. And what is the email address for that?
I think if you go to our task force website, so the COVID-19 Immunity Task Force, you'll see it up there. You can register July 15th, Thursday, July 15th at noon Eastern Daylight Time.
Catherine, thanks so much.